Hello everyone, it's me Uswah. So today I'm going to do a Q&A video answering your questions. I received quite a few questions from my previous videos and through Facebook, so I thought I would do just a Q&A video and answer as many as I can. I've got my laptop here which has the questions and I'm just going to read them off there and then answer your questions. So the first one is, how do the exams work? So this is for people who are thinking about coming to Bulgaria or who may be in first year. What you have is a basic structure which is carried from first until fifth year, and then in sixth year one of these parts is missing. So what you have is you have your multiple choice questions, which is or it's also called your test, and if you pass that part of the exam you move on to the next part of the exam, which is your essays. And your essays are basically a list of topics from your conspectus or your syllabus, and any of these could come up on your exam. It's picked at random and you would answer that essay, and the better you answer, the higher your grade is. And then after that, if you pass that part, you would go on to your oral or speaking exam, and you may have a practical part attached to that. And that is the last part of your exam, where you'll have a discussion with your teacher regarding a certain topic from the syllabus. And with that, with practical parts, it may be, for example, in anatomy, you may have to, see a cadaver and say what that part of the body is. Or if you are in your clinical subjects, you would have a patient and you would have to do a physical examination, possibly take a history, and then report it back to your doctor. So that is how the exams are structured, and you have your exams in the winter semester and the summer semester. So the winter semester exams are in January, and the summer semester exams, where your majority exams are done, carry out through June and July. The difference in sixth year is that you don't have this so-called structure of winter and summer exams. What you would have is depending on the rotation you choose, you have exams at different parts of the year. For example, in my rotation, I have an exam at the end of October, whereas other students in my year have an exam around the beginning of November, some have it in December, etc. So it carries on like that. So that's the main difference with the sixth year. The next question was about attending lessons. So regarding attending your lessons and attendance in general, the university is quite strict, and you do have to attend your practical lessons, and with lectures it depends on your subject. But in my opinion, it is worth going to your lessons and your lectures, just because everything is much more interactive. You will be able to really make sure that you have an understanding of that topic, and if you have any questions, you can ask your teacher right there and then. Whereas if you decide to study from home, you may not understand certain topics, you may miss something, you may just not pick up as much information as you would if you were there and then in your lessons. And you have to remember that your teachers are your resource, and they have so much information and knowledge that it is much better just for your own education to be there. I had one question regarding learning Bulgarian and how difficult it is and how important it is. So in my opinion, the language itself is very hard. I wouldn't say it's something, and in comparison to English, it is quite difficult. On the other hand, it is important because even though your course is technically in English and your exams are done in English, if you want to make the most of your education and really enrich your learning, you're better off learning Bulgarian. For example, if you are from third year and above and you want to examine your patients, yes, your teacher is there to translate for you, but what happens if you want to go outside of your lessons and just, do a history, or you just want to ask a nurse if you can, for example, take bloods or do anything like that? You need to be able to speak Bulgarian to do that. And on top of that, it really is it's much more respectful to the patient as well as to the staff and to the Bulgarians in general if you decide to learn their language, because you're coming to their country, we're having an education here, the least we can do is learn their language. And it's not that hard to learn either. If you start from first year and the phrases that you learn from every day, you just use them when you go out, for example, when you go to the shops, or when you go onto the ward in your clinical years, or just when you're going here and there, it is just useful to learn and apply that Bulgarian. And, go home, maybe watch a TV show in Bulgarian if you can. If not, watch some YouTube videos of some people speaking Bulgarian and just try to really learn that. Just take up maybe an hour every day or half an hour every day, just learning a little bit of Bulgarian. And when you go to your clinical years, applying that when you see your patients. That's that question. And then in terms of your resources, as I mentioned in previous videos, your resources are basically what the basis of your resources should be, what your university provides for you. But to start from the beginning, it's best that you first get your conspectus or your syllabus. So whether you can get that from your teacher, if your syllabus for your exam is not ready, what you can do is they always have a lesson plan outside the department that you are in regarding the topics you're going to cover in that semester. So if you can have that list with you, you know where you're going to study and you can start preparing your notes from that. And then in terms of resources, you want to use the books that the university recommends. These may be books that you have to buy locally, which are specific to the university. There may be books that they recommend that you can get online. If you can get a PDF, a lot of the time the teacher has the PDF available, so you can use that. You also should use the lectures the university provides. And if you go to the lectures, it's even better because you can write down what the teacher's saying, because they normally add extra notes as well. Going to your lessons and writing as many class notes as you can. Those are your basic resources. On top of that, you always have access to the internet, so use YouTube videos. Those are a great way to really help sink in the information. And I think that's about it in terms of your resources. In terms of revision techniques, so revision is very important. I've had a lot of questions about how you really have to, best way for learning. And one of the best ways I've learned my way is, if you know your topics that you're going to learn throughout the year, before you go to the lesson, do try to read up on that topic. If you read up on the topic, when you go to the lesson, you'll be able to really make sure that you have an understanding of your topic, so you're not spending as much time later actually learning that topic. And when the teacher says it to you, it actually just helps sink in the information much better. And on top of that, if you have any questions, you can ask your teacher there and then. And it is just a much more effective way to learn, and it just makes revision in the end much easier because you actually understood your topic. With that as well, other revision techniques include just make sure that your revision is interesting, that you keep it interesting. So this could be, for example, using flashcards, changing that to mind maps, making your own PowerPoints if you can. There's so many different ways to learn. You can also, make your own audios of yourself talking about the topic. It's always just good to keep things changing. And with that as well, it's also useful for you to find out the kind of learner you are. So if, for example, you are a visual learner, then you're better off looking at diagrams, looking at pictures, and looking at PowerPoints, colorful PowerPoints. If you're, for example, a kinesthetic learner, it would be useful for you to find a group of students who you can study with, who maybe you could read up the topic in advance, and then you go out together to like a coffee shop and you just sort of discuss the topic. In like half an hour, you would discuss a few topics, or if it's a very big topic, you could spend longer, and that's obviously going to help with your revision as well. And if you can, it's also useful for you to find multiple choice questions regarding certain topics. If your university provides multiple choice questions, use those with your revision. As you revise, look at the questions and then answer them without looking, and then check your answers. And if you don't have those questions, go online and find some questions and then just check you have the correct answer. It's a really good way just to make sure that you are learning the information, and the more you have to think about your topic, you're more likely to remember it. Because you obviously you're using different parts of your brain, because you really have to answer those questions yourself. Applying theory practically. So I've had questions regarding what's the best way to learn all that theory and apply it in your clinical years, but I've also had questions about just learning theory in general and applying it, whether that be for preclinical as well. So I'll start with preclinical. When you, for example, in anatomy, you learn your theory. The good thing about Bulgaria is that, at least for my university, you have access to the cadavers. So when you learn your anatomy at home, go to your lessons and make sure that you understand exactly where each part of that body is, where those different vessels are located exactly, or different parts of the heart. And in terms of other preclinical subjects, for example, physiology and biochemistry, it's really useful for you to make clinical correlations. So for example, if you have a essay topic on the thyroid gland, you would want to make sure that you understand what are the clinical manifestations if that patient had an overactive hypothyroid thyroid gland or an underactive thyroid gland. And that just makes your learning much better, because you can understand why that topic is so important, or why that gland is so important, or anything else regarding physiology. And that is really good basis for your pathophysiology exam, which you have in third year as well. With regards to, for example, same with biochemistry, if you learn a cycle and then you can try to understand what would happen if for some reason that cycle ceased and wasn't working, and what manifestations it has for the body. That's just an easier way, and that's really going to help your learning. And just in that case, you're applying your theory practically. With regards to clinical subjects, for example, surgery, internal medicine, specific subjects within those, the best way is through case-based scenarios. So I usually just go online and find a scenario. For example, a patient comes in with hepatomegaly, they have dyspnea, they have tachycardia, and your question may be, and they're this old. The question may be, what sort of investigations are you likely to carry out first, and then what sort of management would you recommend to your senior doctor, and then you can check your answers through that, through your clinical based scenarios. Besides online, if you can go onto the ward and find patients with that certain morbidity, even better, and then you can ask your doctor what sort of investigations and management would you carry out, or you can suggest to the doctor, I was wondering, would we do this or would we do this? So with that way, you really are applying your theory practically, and with your doctor there, they can really just make sure that you are answering it properly, and if you've made any mistakes, they can correct you and tell you why you made those mistakes. And obviously that's just the perfect way of learning. How much free time we get in our years? Well, in terms of free time, every year you're going to get plenty of free time. Well, I wouldn't say plenty. Every year you're going to get a good amount of free time. It just depends on how organised you are and how you utilise your time. So you want to make sure you dedicate some hours every day in making sure that you have learned the information that you studied at university, and that you have written up you have all your information together. As when it comes down to revision, you're not going to spend a long time looking through different papers for information which you did record throughout the year. So for example, come home every day and you have a notebook. You may have one notebook which has multiple subjects in there. You just want to make sure that you have written those up neatly on a separate paper and split those topics up into different subjects, and you have different folders. Or the other alternative, which I do, is I write everything up on my computer. So I may have a folder titled pharmacology, and within that I would have certain topics, for example, drugs related to the heart, and I would type up all my notes on that. Or I may have drugs related to the respiratory system and have that typed up into one folder as well. So that's one of the things you should do in your free time outside of university. And otherwise, there's plenty of things you can do in your free time. You should make sure that you spend free time being, going out, seeing your friends, exercising, looking after your health, looking after your mental health, making sure that you take time out every day to understand how you're feeling about yourself. And also, it's important as a mindset, we as doctors should always think about educating ourselves, because that's just what we're going to be doing throughout our career. Medicine is always changing, and you'll be educating yourself. So try to have that mindset now. And if you have any free time, you don't have to exactly go through medicine, but educate yourself through the news, educate yourself on the latest advances that are happening in medicine. You may want to educate yourself on things around the city you're studying in, but just try to take time out to learn things. Learning is the best way to spend your time in general. And otherwise, focusing on your health as well, and just using your time in a positive way. And because procrastination, at the end of the day, it is a slippery slope. You can start off procrastinating a little bit and it can just keep going. So do try to keep yourself timed, and try to use other free time just to keep yourself doing productive things and useful things, and you will feel much better as well. Yeah, and what else is there? Oh, and extra things the university offers. So I had some questions regarding, besides our education, what the university else provides for us. So there are a lot of things the university provides for us. One of these include the new simulation center they've made. So if you go on their website, you can actually sign up for certain small courses that you can do. For example, respiratory examinations, or pediatrics, cardiovascular examinations on a child. So if you sign up for them online, there's a limited number, but you can sign up in advance and then you can go and practice on the simulations over there. Besides that, they also have different courses they carry out, because these are European universities, so they're often working with other universities and they have different conferences. They also bring in speakers from different countries, so which is all very interesting, and they're always free for the students for you to attend. You just have to register in advance, and they're very interesting, so I do recommend when they have them that you do attend them. They also have different trips which are carried out by ESN, which is part of the Erasmus program, and they carry out different trips to cities around Bulgaria. So and they're for a discounted price. So as a student, it's great for you to go on these trips and just discover the country you're studying in. And another thing, speaking of that, is the Erasmus program, which is an exchange program which they allow students to carry out, and it's offered to all students. You just have to sign up in advance and meet the criteria, and it's a great opportunity. So if you can do it, I do recommend that you go for it. What to avoid? So things to avoid, I would say, for what I've learned is, one thing is to avoid being alone and isolating yourself. Being in a foreign country, it's easy for you to become, just feel lonely in general, because you're away from your family, you're away from the people you're used to, and you're in a new environment. And even if you've been at university for a few years, it's never good to isolate yourself. Please do make sure that you take the time out to go out and see people, see good people that have a positive influence on you. Even talk to your teachers in your free time as well, if you can, about anything. And find people online that maybe have similar interests to you, and just hang out with them. And but obviously not strangers. I'm talking about, like, find people from a university who may have similar interests to you. For example, if you are in a society and you find people who seem very nice, just go out and meet them. And that's another thing. Societies are a great way for you to avoid being alone. So if you can, if you join a society, do try to go to the events that they offer. And if there's a passion that you have that you don't see a society for, start a society yourself. Your university often doesn't have those societies just yet, and you can think of it as a blank canvas. So if you have a passion for something and it stops you from being alone, and it's a way for you to make friends and for other people to get together, why not start your own society? The other thing is to avoid spending unnecessarily. So because things in Bulgaria are cheaper compared to the UK, which we can all agree on, it doesn't mean that we have to always spend and splurge unnecessarily. A lot of the time, if we're young, we are using our parents' money. So ideally, we should save that money and just think that when we're doctors, we're not going to be able to splurge as well. So we should get in that habit now of just spending sensibly, even if we are in Bulgaria. And the money you save, you can use that towards educational resources or towards going on some interesting trips, instead of just spending it on, going to different restaurants when you could just cook that meal yourself. And you do want to be able to have those sort of habits of looking after yourself. Another thing to avoid, as I mentioned previously, is to avoid speaking English when you go out. When you are going out locally to the shops, for example, or you're going to just certain places here and there, just try to speak Bulgarian. It's only going to help, it's only going to help you learn the Bulgarian that you need to know anyway. And on top of that, it's just a way of respect to the locals around here, that you learn their language. And you can meet so many interesting people through speaking Bulgarian as well. Another common sense thing, but a lot of people fall into it, is going into the wrong crowd. So what I mean by that is, being away from home, it's very easy for people to feel like they can do whatever they want, but you need to remember that you are an adult. You're going to another country. You're coming here to educate yourself, to learn, to become a better individual. This is the most free time you will have, and why not use it to just become an all-rounded better individual? And your friends are a reflection of who you are. So try to find people who are just as keen as you to learn, to grow, to use their time in the best way possible, and hang out with them. And if you find the wrong crowd, try to avoid them, and if you can, try to have a good influence on them. Tell them in the nicest way you can, or encourage them to do better things with their free time. People are sometimes just lost, and it is useful if you can just have a good influence on people. Be an example to other people. And one more thing as well, which is common sense, but people still do it up till now, is just respecting the teachers. So please don't disrespect your teachers. You have to remember that your teachers are adults, they're doctors. Look at them like the way you would as a consultant on your ward when you become a doctor. You have to respect them. They are a resource to you. They have so much more knowledge. They are adults. Come to your lessons on time and respect them in the lessons. Ask them questions during your lessons, whatever you have. It's just easy for people to fall into these wrong habits, and I just really recommend from the beginning, but please respect your teachers. And yeah. And another important thing is my final tip to avoid draining yourself. Because you're studying medicine, you may have this perception that you have to constantly be studying, be constantly, being productive. I know I gave a lot of tips about being productive and you spending your time wisely, but please do not drain yourself. Take time out every day. Take a couple of 1 hour, half an hour just to focus on yourself. See how you're feeling. Take a time out to watch a TV show which makes you happy or talk to your family, but always avoid draining yourself. Just remember that we're young. This is the most free during our degree. This is the most free time we have before we go to work, before we have all these bills, before we have our own families. And it's just the best thing for you is to use that time as I said, productively, but also to think that if I'm drained now, how will I feel when I'm a doctor, when I'm doing all these shifts on the wards, when I'm doing night shifts as well. You've got to learn to utilize your time the best way possible. And I know that you have plenty of free time when you think about it, and just use that time in the best way. And just look after yourself. Always prioritize yourself, and just make sure that you're getting enough sleep, that you're having enough support, and you're looking after yourself and being mindful. So in terms of applying for jobs, I haven't started it just yet because my 6th year is a full year. So I start in September and I finish in September of 2019. So for me to apply right now is quite early in advance, and from what I know, the UK doctors who apply, they apply at a different time of the year to the international graduates. So I'm not exactly looking at the way the UK doctors are applying. I am keeping in touch with all this, and keeping an eye on how I would have to apply for a job. I have a sister who is studying in her 5th year now, who is going to be applying for her job soon, but from what I know, I'm not going to be applying the same time as her. But I am researching into this as well and keeping in touch with the GMC. And when I do get more information and when I start applying for jobs, I will definitely share this information with you guys. I would rather not just give false information right now, so please don't mind this for now. And with that, I'm just going to make sure that within my 6th year, I focus on mentally preparing myself for work in the UK, whether that is, looking at the GMC guidelines, whether that's looking at the NICE guidelines for prescriptions, whether that's performing my OSCEs and making sure I know my physical examinations in history taking well. And those are the kind of tips using my Oxford Clinical Handbook and my Foundation Handbook, and just making sure that I'm prepared as much as I can while I'm in Bulgaria for work in the UK. And when I can, I hope to, if I have any free time before I finish, which I'm sure I will, before I apply for jobs, I would use that to shadow doctors in the UK. But as I said, I'll get more into that in future videos. And another thing is, I've had a lot of questions regarding my experience of living in Bulgaria and the lifestyle in Bulgaria and spending in Bulgaria, and I will get to that. That will probably be my next video, so don't mind me if I haven't spoken about that in this video. So that is my video for now. Thank you so much for watching, and I hope to see you in my next video. Bye bye.